All right. Good evening, everybody. I know that we were supposed to be having this conversation as a Facebook Live. Unfortunately, technology was not our friend this evening. So we are recording our conversation to share with you all. Feel free to post questions on this video when we post it, and we will get back to you with responses as appropriate. That is one feature that I like about the Facebook Live, and we won't be able to do tonight. However, I do think this conversation will still be valuable for everyone, and I'm excited to have with me here Jody Canacula, who is a licensed clinical social worker who specializes in working with seniors and has a lot of expertise and knowledge on this subject, and Joan Davis, who is a senior herself, and she also has a background as a public health nurse, and she continues to do community education, especially related to nutrition, and mostly with seniors. So they both have a lot of experience and expertise to share with everyone, and I'm excited for this conversation. So we are addressing issues that are impacting and affecting our seniors in particular. I feel this is an incredibly important conversation to have. Seniors make up almost 20% of the population in the 65th district, which is pretty standard. But they are an important part of our population, and I feel often get left behind when we're talking about policy and legislation and talking about issues. I do feel that we should be always mindful of our seniors and the special concerns and issues and needs that they have. So I'm excited for this conversation and to share this information with everyone tonight. So first up, and a very obvious one for tonight, COVID-19. We know it's especially affected our seniors because of their increased risk, their vulnerability. In addition to anyone with underlying or pre-existing conditions, seniors have had to be a lot more cautious during this time. If they live on their own, that's meant increased isolation and difficulty accomplishing normal activities like grocery shopping, or any regular social activities like church and their normal social groups, which are really important, especially for their mental health. We also know that issues arose around assisted living and long-term care facilities in particular, with more than 28,000 seniors being infected and over 4,000 dying from coronavirus in Illinois. IDPH has delayed inspections of facilities in an effort to prevent inspectors from catching and spreading the virus. However, a number of long-term care facilities had not been following protocol, some with improper mask wearing, not completing regular symptom screenings, etc. In addition, the lack of a coordinated federal response meant that there was not appropriate PPP available to protect this vulnerable population or the staff who care for them. And all of this led to tragic loss of life. So Joan and Jody, as the pandemic continues to drag on, with flu season soon upon us, what steps do you believe are most important in protecting our seniors? And either of you can go first.
Well, one of the things I think that we sometimes need to step back and say, what do we know and what misinformation? There's so many myths out there, and I do a presentation on COVID, and it's surprising, but it's we have a lot of leaders who are giving out misinformation, and it's easy, and we're human beings. We want to believe that this will be done, this will be over soon. We want to believe that, well, maybe they've exaggerated it. So I've gone into senior groups, and there are folks that are educated people who still have kind of fallen for some of these myths. So I think that's, first of all, we need to believe it's a real problem, and that we do need to do the social distancing, and it is worthwhile to wear the masks. So I think that's one of the first steps. And then just this whole idea that we need to believe the experts, because if we don't, we will not be able to resolve this issue. So that would be one of the things that I think we need to stress. Yeah. And Jody, I don't know if you have some additional comments.
Well, I think I've been pretty lucky. The seniors I've worked with all are science-based, I guess. They believe the science. They don't believe the kind of wild things they're hearing. So that hasn't really popped up a whole lot. Although there has been some conflict with their families over wearing masks. So that's about the only thing I can think of.
Mm-hmm.
I think moving forward with the pandemic, I think we really have to have some kind of plan for seniors. That's one thing that I didn't see at the community level, because of course, how would we know that we needed a pandemic plan? But the isolation is getting worse and worse for seniors. And we need to come up with some kind of plan where we can reach out to folks and find new ways to connect with them while this pandemic continues in our community, because a lot of them are not leaving their homes.
Yeah.
So that, that can be very difficult.
Absolutely. So another topic that I think is really important, especially right now with 35 days until the election, is voting and voting safely. And with so many changes this year to voting, I've heard a lot of concerns and a lot of confusion from everybody, but maybe especially from seniors who are wanting to be particularly safe and careful in their exposure. So I know I've talked with seniors about some of the things that they're concerned about or worried about with voting. A lot of them are opting to vote by mail. And so they're, maybe they haven't voted by mail before and the process might be overwhelming. I know some seniors I've talked to are concerned because their ballots got mailed to their house for both them and their spouse, but their spouse is in an assisted living facility and they're not sure how they're going to get that to their spouse. And, some people I talked to said, well, I guess she's just not going to vote this year. And I said, no, you need to contact the nursing home and make sure that there's a process so that your spouse can vote. So I think that there's still some confusion out there. I know we're going to drop some links if people are still looking to request their vote by mail ballot for the Kane County Clerk's Office as well as the McHenry County Clerk's Office. I know there's some confusion and some people are worried about putting their ballot back in the mail. So they're looking for where those drop boxes, the lock boxes will be located to drop them off there. And then some people are opting to vote in person because they feel more secure about that. So they're also interested in finding out what are the slowest times at the early voting locations, which generally mid-morning, I think, seems to be the slowest at most of those locations. Of course, anybody voting in person should make sure they've got the hand sanitizer to use and bring their own pen to do their signature. But have either of you heard any other questions out there in the community about voting safely for seniors this year?
For my clients, it's mostly been, is my ballot going to get there? Because they are doing mail-in ballots. And so we spent some time talking about, is the mail safe? Where should I drop it off if not at the mail? So we've done that. And then also that form is confusing if you haven't used, and there's an error in it. So the seniors are even more confused looking for the second envelope. I didn't get the second envelope, so we do that as well. I think if they could have someone help them, even if it's over the phone, they don't have to say who they're voting for. They could just say, what do I do in this section? That might help. And one of the things I've been concerned about also is, are the people in long-term care voting? Are they going to get that opportunity? I have no idea, because they're certainly not going to have voting booths, and nobody can go in there to, register or give them vote by mail applications. So I really wonder what's happening there.
So I have actually reached out to a handful of assisted living facilities to ask that question. And it seems like at least the ones that I've been in touch with are taking it very seriously and ensuring that their residents are able to vote. Some of them said they do offer rides for people that can and want to vote in person early, and some are ensuring that they're getting their vote by mail ballots. So it seems like, I know that's not always the case 100%. Joan, have you run into any questions or experiences around voting?
Just a few have expressed concern about possible harassment at the voting site. So I think that that message needs to be clear that, you know, there are guidelines, and maybe now we wish we could push the barriers back a little bit, but people are not allowed to harass, and the judges are looking for that. And also just a comfort measure. I have a 92-year-old mother who said, I'm gonna vote if I have to crawl there, but she will be going with my father, who has difficulty standing for long periods of time. And I think people need to know, if you need a little stool, bring it along, you know, it would be acceptable. You know, so just some comfort measures. Make sure you bring some water, because you may be waiting for a long time. So so that they understand that there's maybe a lengthy wait, and here's what's allowed to do, or that you're allowed to do.
Yeah, those are good points. And also with the vote by mail ballots, people need to make sure that they're getting their signature on there. And I know there's some concern about signatures changing, especially, you know, with health conditions and maybe, you know, difference in signature over the years. I know some people are concerned about that, but there are a panel of 3 election judges that will review the signatures for, you know, making sure they look similar, but in general, it should be fine. So moving on from voting, one of the top issues that concerns seniors, and I know we talked about COVID-19 already, but healthcare in general is always a concern, especially for seniors. Seniors obviously are more likely to have pre-existing conditions. They're more likely to have limited income, cover the costs associated with care. Medicare actually now serves 60 million Americans. And about 18% of it, that makes up about 18% of the United States population. Many seniors also have combined Medicare and Medicaid policies, which have notoriously low reimbursement rates in Illinois, often making it difficult to access care. Additionally, the cost of prescription drugs adds a burden to many seniors' budgets, often leading them to either cut pills or be forced to choose between their medication or their food. With the current administration working hard to undermine the Affordable Care Act and pushing to prevent regulations that would help reduce costs, many seniors are especially concerned about the outcome of this election. What can either of you share about your experiences and what you hear from seniors about their concerns with regards to access and affordability of healthcare? And prescription drug costs as well. And what solutions have you heard of that would enable us to better provide for our seniors?
What I'm hearing, and I always hear it, it's not new, is the expense. So I have one senior who, she's on traditional Medicare and she has a supplement. Her supplement went up $1,000 this year. And she's on a fixed income. And so she is having to make those choices. I offered to help her find a different supplement, but she didn't want to do that. Unfortunately, the supplements are an issue because they're private insurance. So Medicare or the government can't tell them you can only charge this much, or you can only raise it this much. And Medicare is it's a little bit in trouble right now because it's slowly being privatized. There are Advantage plans, Medicare Advantage plans, which is private insurance, and seniors can choose to have that, and it tends to be less expensive. They cover things like teeth and hearing aids sometimes, but the problem is that it's like an HMO. They don't really have a choice on where they go, whether it's the doctor or the hospital. And so now 30% of Medicare recipients are getting these not Medicare plans. And if more and more do it, then there won't be enough money in the Medicare pot. So then Medicare will collapse. And that's not a good thing, because Medicare is a wonderful program. I mean, it needs to be tweaked for sure. I think we absolutely have to add dental and hearing for physical and cognitive health. And I think we need to look at the costs. So the solutions, honestly, I think if we could make Medicare stronger, and I think a way to do that would be with a universal healthcare plan, which of course is at the national level. But for the state level, and for you, Martha, you could spend some time on trying to get the Medicaid pay better in Illinois.
Yeah, Joan, what about you? What's your experience, or what are you hearing with this?
I'm hearing people concerned that if Medicare wouldn't be an option, then okay, we'll go to the emergency room. And we all know that that's the worst place, but you know, that's going to be a reality if we can't continue the care, you know, as it is now. So and with COVID, that just is terrible, you know, folks going into the ER. So it's a real medical concern that we hold on to the healthcare that we have and make it better rather than just eliminate it. So you know, any efforts on a state level to support those programs are crucial.
Absolutely. Thank you for your input, for both of you. I've heard a lot of folks saying that they're concerned about the possibility of taxing retirement income if the fair tax passes. State Treasurer Michael Frericks has clarified his comments that he made previously that have now been taken out of context and used to scare people out of voting in their best interests. The passing of the fair tax does not lead to taxing retirement income, and I'm not in favor of taxing retirement income. Passing the fair tax would give the state much needed revenue to allow the continued funding of programs and services that benefit everyone, including seniors. Have either of you heard these concerns from seniors that you talked to? And do you have any additional questions that you think folks would like to have answers for?
Yes, is the short answer. This is a huge concern. And for me, it's the problem is that if you tell them the facts, they don't believe it because they're reading, I don't know, the sources that are scaring them and aren't accurate. And so, no, they're going to do it. They're going to do it. And they're really scared. I mean, seniors are frightened of a lot of things right now, including that one. So I try to recommend like the online information sessions about what you know, what the fair tax is, and send different reading materials. But there's a group that they're just not going to believe it no matter what. They think the state is coming after their retirement income.
Joan, are you hearing?
I'll just say the same thing. That's what I'm hearing. People are really frightened, and you know, with all the fear tactics out there, it is really hard to say, wait a minute, you know, I did see one response that was honest, saying, okay, the state's in terrible shape. We may have some increased taxes, but does that mean, you know, that this proposal will mean you're going to be taxed more? So, you know, you may be taxed anyway, and then you're going to really be upset. So in other words, let's put it in perspective. You know, there may be some taxes. I don't know that, but this argument was, you'll probably get higher taxes. At least you know what rate, you know, with the new the proposal. So, but people are very concerned. I'd echo what Jody says. Yes.
Yeah. Moving into our next question. So, mental health concerns and needs of seniors are frequently overlooked. Having spent time working in the mental health field, I have an understanding of the wide array of concerns that seniors present with when seeking mental health services. And I know that much of this has been exacerbated under current circumstances. I know that telehealth or teletherapy has been an incredible breakthrough for many seniors, while it's also compounded the loneliness of others. What can be done to better support the mental health needs of our seniors going forward?
I think probably the most important thing is that the people who come in contact with our seniors, including and especially physicians or nurse practitioners or home helpers and the families of the seniors need to be talking to different resources for mental health. So I have a contact at Central DuPage Hospital, and when she sees somebody that comes through the ER that needs mental health, in her opinion, she gives me a call. We need more of that, because especially with seniors being so isolated, the mental health was bad. The isolation was bad before this. And so I think especially if we could get the physicians to help us, that would be great.
Yeah, that's a really good point. Joan, what have you?
I'm thinking of it in terms of perhaps the not so serious mental health crisis, but improving mental health involves continued learning. And that's where I come in, because I do presentations to senior groups. And yeah, we've had to adapt. Now we do Zoom programs, but they're crucial. And the seniors are very appreciative that this is a way to connect. And, you know, once we get over the barriers of how to use Zoom, it connects them, and it allows them to feel like, okay, I'm still progressing here. I'm learning something new. And, you know, again, we need to take care of the crisis situations, the suicide, you know, the increased suicide potential, and the severe problems. But then we don't stop when those are taken care of. I think then we need to look at, well, how else can we help seniors? And programs that have senior programs, you know, learning programs are crucial.
Yeah, that's a really good point about the connection, even through Zoom programs. I think it's so important to have those connections. And I know, you know, a lot of grandparents have been, you know, thriving on the Zoom family chats every week. So that's definitely, it's important to still maintain those connections as much as possible in any way.
With the holidays coming up, I think especially, you know, I think we're going to have increased feelings of loneliness and potential suicide thoughts. So,
Yep.
I am very concerned about this, because I'm sure you know that the largest age group that commits suicide, it's men over 65. The second largest are men and women over 85. So it's our seniors primarily who are killing themselves. And you don't see a lot of, at least I don't see a lot of focus on that, on, you know, seniors and the kinds of things that Joan was talking about. That is absolutely crucial. You have to be involved with other people and socially and learning, because that can lead to the isolation. And I've been trying to think outside of the box on what we can do to help folks who are isolated. And I really think if you know a senior in your neighborhood, or your parents or grandparents, and you just can't see them, first check on them, see, do they need, can I go to the grocery store? But little things like call them like once a week, send them a card, take something out of the newspaper or magazine that you think they would like. I mean, that those seem like little things, but when there's nothing happening, that really is going to mean a lot to them.
Yeah.
Absolutely. I have a 95-year-old aunt, and about once a month I send her something, and I know during this time it's really important, you know. So it doesn't have to be a long letter, but just, and like Jody said, put something in there like, oh, my aunt was an artist. I saw this, and with your artistic soul, I know, you know, you could appreciate that, so that she knows that she's still being seen as a human being. Is so important.
And people know she's there, right?
Yeah.
You know, people know that folks who are isolated are there. And about half of my clients do not have a computer. They have no access to Zoom or anything on the computer, and they wouldn't know how to use it if they did. So it's even more important, some of these old-fashioned sending things by mail.
And that's why we need the post office, by golly.
Oh yeah.
Absolutely. Support the post office and support our seniors. So thank you for that. And I think that's so very important to maintain those connections and to think about the seniors that are in your life in any way, shape, or form, and do anything that you can to reach out to them and let them know that you care and you're thinking about them and they're important. And so this topic breaks my heart, but we can't avoid it. We've all heard of cases of elder abuse and scams, heartbreaking mistreatment of those who deserve to be respected and honored in our communities. If anybody, if you haven't seen the show yet on Netflix, there's a series called Dirty Money. There was an episode titled Guardians Inc. That talked about how people abuse guardianships to rob seniors. It was absolutely heartbreaking. I was a puddle of tears after watching it. But from organizations that intentionally target seniors for scams to physical and emotional abuse, there's no shortage of examples of horrendous treatment of seniors. While many are working to end this, what more do you believe should be done to ensure that we protect seniors? How can we empower the elderly and work to stop these kinds of things from happening?
As far as guardianship, public guardianship in the state of Illinois, there is nobody that really supervises that. It's a dead end.
Mm-hmm.
I've tried to contact, whoever is in charge to say this guardian is really not a good thing for the client. There's nobody.
Mm-hmm.
So that is perhaps something you could look into, Martha. What's the process? Is this a process that's really going to help our seniors, or does it just kind of lead to nowhere? Because that can be a major problem. The guardians are supposed to visit their folks as well. So that it's going to make it harder because they can't go into the different places. As far as the other fraud, like on the phone frauds are terrible because a lot of seniors pick up the phone no matter who it is, and they believe it. And we know that as the brain ages, that we lose a little bit of our ability to have good judgment. So that is what happens with those. I don't know. I mean, I've talked to the police about this, and you can report the numbers, but it seems like you report one number and 5 more come up.
Yeah.
I have told my seniors, if you don't know who that is, don't answer it. Just don't answer it. Because once you do, they'll call you all the time.
Which is hard when they're lonely.
Yeah, you finally get a phone call and yeah.
Right. And that actually could be a problem as well. They are lonely, they want to keep somebody on the phone, and so they're going to be more vulnerable to doing whatever that person wants them to do.
Yeah. Yep. Joan, do you have anything to add to that?
Well, I'm just thinking in terms of, from a nursing perspective, I think sometimes the staffing is unrealistic, and it may not be abuse, but it can be neglect because you've got too many patients and too little time. And now with COVID, you've got all kinds of other additional chores. So I think we really need to look at staffing and pay, and finally recognize that, if you are wanting good care, you don't just get someone off the street, with the minimal. You need to invest in those employees.
Yeah, there's a lot that can be done with the nursing homes, and that could be a whole presentation, Martha. And that, they are governed by the state, so that is something that you could do or get into, because there's a lot of problems there, and there continue to be problems. And the staffing, like Joan said, it's horrible. I don't know if you've ever seen how hard those CNAs work to take care of folks. And they'll have 10 or 12 clients or patients right during that shift, and that's impossible, and they're paid nothing in relatively. So in nursing homes, we can make those better in Illinois. We definitely can, to help our seniors. We just have to keep talking about it.
Absolutely. I agree. Thank you for that All right, so while we've addressed many concerns and issues facing seniors, there are definitely many more. And as Jody said, some of these could be their entire, be an entire discussion just on their own. And there are many services that exist to respond to these needs. However, there's a plethora of senior services, both state and local, and it can be overwhelming for seniors to try and navigate and sort through all of this. It's often leading to confusion and maybe even just giving up on seeking the services altogether. With seniors looking for access to food, transportation, social interaction, healthcare, mental health care, and so much more, what can or should we be doing within our communities or at the state level to make it easier for seniors to access the services that they need?
I would love to see the state pay for a mailer to go to every senior in the state that would have, we could put the phone number on there for the area agency on aging, because that's like a clearinghouse. It's a federal clearinghouse that governs all the rest of the senior programs in Illinois. And so that we could say, you need help, call this number, because that number, then they can tell folks which place to go to. So I would love to see that. I know it's expensive, the mailing alone, but that is a way to get to all of them, because finding the seniors is the difficulty.
And certainly having something mailed as opposed to saying, well, it's online, now for savvy seniors, that's great, but we're going to miss some folks. So I think the idea of a mail and then have it updated regularly as the agencies change. But again, that's an investment, and we need to invest in our seniors if we want them to do well.
Absolutely. I agree. All right. I've really enjoyed our discussion. I'm so full of new ideas and things that I'm excited to hopefully work on one day. So thank you both. I really want to end our discussion on a positive note. I personally have been thrilled to see so many seniors who are actively engaged in their communities and in current elections, especially, including my own. Finding many opportunities to contribute in ways that keep them safe, but also help them feel empowered in choosing what the future looks like for them. Do you, either of you or both of you, have a story or an example that you'd like to share that demonstrates the hope and positivity that seniors add to our communities? Because I do think they do, and we often don't focus on that. Or do you have ideas for how we as a community can help our seniors feel less lonely, COVID or no COVID? And I think we touched on that already, but if you have any additional pieces to add to that, I'd appreciate it.
I would like to see more integration between seniors and schools, because a lot of seniors have education backgrounds, but they all have a wealth of knowledge and experiences from their lives. And that's good for the students. That's actually unique. They can't get that anywhere else. And plus they're going to feel that they have a purpose. And losing your purpose in life is one of the worst things that can happen, no matter your age. And that's one of the things that seniors struggle with. So I would love to see schools and seniors working together more. I would love to see cities reaching out to their seniors and saying, hey, we want to have a talk at the library about the Depression, and we know you have firsthand knowledge. Would you come and talk to the group? Things like that. Reaching out to them and saying, we think you are important and your experiences are important and we want to hear about it.
Those are good ideas. Joan, how about you? Do you have any positive stories?
The thing that impresses me when I talk to seniors is how they are positive, and they also are looking at the next generation and are concerned. I think that, I've heard so many times, I want to leave this world a better place. That is so often the thought and real concern about right now with our environment. So I think that, the more seniors can be involved with making sure that we aren't changing regulations so that we don't get clean water and clean air, or that we're not bulldozing down our forest or having pipelines. Seniors are interested in those things because they see that will affect my grandchildren. And I don't want to leave this place a worse place because we were so concerned about money that we didn't protect our environment. I think seniors, from what I remember, the word environment came up when I was in junior high. It was a new concept, and I've seen it grow and people being more conscious. And now I see that there's a real kind of pushback that no, especially, you know, with some regulations now. So I think seniors are concerned, are we going way backwards instead of protecting our environment? And there's a real issue with time. We got to work on this now. So and I think it's great that seniors care that much, because they may not get all the benefits of the change, but they're concerned that they don't want to leave a mess for their grandchildren.
Yeah, and that's a great idea, because we could pull those seniors into working in the community, advocating for you know, better practices in our environment. Why not? You know, we miss out on so much because we are not engaging our seniors enough, and they have stories and they have knowledge and experience, and it's one of the favorite parts of my job. And I feel a little bit like a time traveler, because I have been just all over the world in every decade, doing all kinds of things, and I will never forget those stories. So those memories that they have are now my memories. And I think if we can get seniors more engaged with other people, with, you know, non-seniors, we're just all going to benefit.
Absolutely. I completely agree. And I've been lucky to have so many seniors in my life, both in my campaign and my work and church and everywhere. And I value them and want to make sure that they feel valued in return. So thank you both for joining me for this conversation. And I look forward to getting some questions from people when we post this, and hopefully the two of you can help respond to some of those as well with your expertise.
Well, as a senior, I just want to say thank you for your concern, because that isn't always the issue. That isn't always the case. Let's put it that way. So thank you for hosting this.
Yes, thank you, Martha.
Absolutely.
And we can't wait until you're elected.
Exactly.
Joan and I will be on the phone every day. Oh, we thought of something else.
Please do. Thank you.
Thank you.